Hi everyone, and welcome back to my channel. Again, my name is Renee if you're new here. So today I just kind of wanted to give an overview of my life in the Army. I have some notes. Life in the Army, pros and cons, why I separated, and then what I've been doing since that time as a civilian nurse. So hopefully this will be helpful to you. And yeah, so let's go ahead and get right on into it. So, first of all, life in the Army, I will say, I mentioned in my last video, it really almost feels like a different life to me because it was so long ago, but not long ago at the same time. So, I was in the military from 2010 until 2014. So, here we are at the end of 2019. So, it's been going on almost 6 years that I've been, separated. And, I will say the time that I spent I was in for 3 years and 7 months. And initially, my obligation or my, I forget what it's called, it's been so long, but my time to serve was 3 years exactly, so 36 months. And during my time I decided to go back to school, and I was super excited about it. Once I was in it, it was just too much. It was too much between studying, working full time on the floor. I was still working 12-hour shifts, and I decided that it wasn't the best option for me at that time. So I was doing the portion of tuition benefits where I didn't pay for anything. Basically, I want to say I paid for books. I can't remember, but I was still active duty. So the military, provides you to go to school at no charge, opposed to when you get out, which I'll talk about, like with your GI Bill. In turn, what happens when you do something like that is your obligation, your service obligation, becomes a little bit longer. So instead of 3 years, what I owed them was an additional 7 months. And that was calculated for the amount of time that I was enrolled in the program. So, so 3 years, 7 months is what I did. And, life within the Army while I was in school, while I was, just active duty and on the floor was amazing. I mean, there's definitely pros and cons that I'll get into of being on the civilian side and being on the active duty side. But my work life wasn't too much different than what it would look like in the civilian sector. So I worked 12-hour shifts. We had self-scheduling, but it really wasn't that. I mean, you would sort of get what you requested, but it wasn't guaranteed. So most times I would work, maybe 2 or 3 shifts in a row and then have maybe 3 off, or I would work 2 or 3, have a day off, come back for 1, off 2, work 4. I mean, it was just all over the place. And also with that, we had to rotate to nights. So I want to say every 3 months, we would go to a night rotation of a full month. I wasn't a fan of nights. I didn't mind the actual work during the night shift and working with people on nights, but it was just trying to function afterwards, post night shifts, trying to go to sleep, trying to stay asleep, trying to feel rested. I just feel like I could never really get a hold of that different type of a cycle of sleep. So about every 3 months we would rotate to that. You can choose to go to nights if that's what you wanted. And then, so we did that. There wasn't any type of set system for weekends. You had to work so many weekends out of the month. And then you were on call. So, if a civilian would call in, the next person on the list would be, active duty. And then even if you weren't on call, sometimes you would be called in, which happened to me maybe once or twice. And you can't say no. You can't say no. If you're sick, you can't just call in and say, "Oh, I'm sick for the day." You actually have to go to sick call and basically go to sick call, and they determine if you're going to be on quarters for the day, which you have to take it back to the floor and show proof of that. Or they say, guess what, you're going back to work. So there's no like just picking up the phone. Like I said, you actually have to still go into work and report for duty, and go to the ER first. So yeah, so that wasn't too much different. The scheduling could be, kind of weird, but you had days that you could request off, which were a little bit easier to um, kind of not guarantee, but if you wanted a select schedule through the week, that was a little bit more difficult than just requesting off a day or a couple of days that you wanted off for whatever reason. So that aspect was pretty much the same. And again, I worked on a med surge floor. So what else can I tell you about working on the floor? We would wear a uniform to work every day, and I'll try and put some pictures in here, either insert here or at the end if I can figure out how to do it. But we, yeah, wore a uniform to work, and then you had the option of changing into scrubs, but you couldn't just walk into the hospital with your scrubs on, and they were hospital issued scrubs. At first they were hospital issued, and then I believe we could go and change into the scrubs that we purchased on our own after they changed the color, from what I remember. So yeah, so not too much different than what it would look like on the outside. I worked with civilians, I worked with civilian nurses, civilian doctors, and then also on the other side, Army physicians, Army social workers. I mean, the whole collaborative team. There's nothing different. It's the same thing that happens. And then, like I mentioned in the other video, being in the Army, it's all about leadership. So getting you in those positions that maybe you're not so confident in yet. So charge nurse, preceptorship, you're kind of pushed into those roles to, develop who you are as a nurse and as a leader. Most of all, as a leader. So you rotate between that. Um, so I would have the role of charge nurse. Um, I would say, I mean, throughout the month, every so often, and then sometimes for the whole month. Um, you were charge nurse if you were on nights or on days, and then preceptorship as well. So, I mean, it was a great experience for me. Again, I came right out of nursing school into the Army, so I got all of my training there, my preceptorship, and then stayed on the same floor along with the outpatient infusion center that I told you all about that I worked in. So lots of fun things. I was able to float to the GI clinic. I could go to hematology oncology. We got a lot of those patients in the infusion center. So, I mean, it was just kind of like a regular hospital position from what I remember when I was in nursing school. I worked as a student nurse, or I think that's what they called as a student nurse. So you were just about like a CNA without the license, but in your junior and senior year, you can work as a student nurse and make money. Also, life in the Army, you are in the Army, so there's physical fitness. We had a PT test um, every every 6 months, so twice a year that you had to pass. So there's a run, sit-ups, and push-ups, and I covered most of that in my last video. So again, if you haven't watched that one, I definitely recommend that. Extra duties on the floor, committees, um, leadership roles, like I said. Um, there's a whole different side of the Army when it comes to your officer evaluation report. So you don't want it to look blank. You don't want to just come to work and just not clock in, but because you don't clock in, but you're expected to do more, and that officer evaluation report follows you. So when you're looking to maybe move to a different duty station, which is called PCS, or if you're looking to go to a course like the ICU, ER, OB, public health course, the surgical course to work in the OR, all of that becomes a part of you. And so you want that evaluation report to show what you've done in the Army. And then also with promotion, being promoted in rank, all of that factors into what's on that report, along with other things as well. What else? As far as extra things, drug tests, you can be called at any time, 4 o'clock in the morning, hey, we need you to report to CQ to have your drug test done, and you have somebody come and watch you, um, do your drug testing. But when you're in the military, there's a certain expectation that, guess what? You can't say I'm out or I'm clocking out and I'm gone. Peace out. It's required that if somebody tells you to stay or somebody tells you to report to work even after you've worked for 12 hours, um, that's what you're expected to do, and that's what you're required to do. So besides that, my life outside of working, it was like a regular situation. You work your days and then you're off. You have time to do whatever it is you want to do, to explore. Um, and there were some days that I had to go into work to do whatever it is that I had to do. But for the most part, not very different than what it would normally look like if I worked on the floor now, as far as my personal life outside. So I think I'm gonna make one more video with that talks about the pros and the cons, because that'll take another probably 10 minutes or so, and then why I separated, and then my life outside of the military. So I'm just gonna make this a 3-part series because I cannot keep it at a minimum. So yes, if you have any questions about what I talked about, again, I recommend watching the first video if you haven't. But if you do have any questions that come up, please put them in the comment box, or you can send me an email at rnforchrist83@gmail.com if you have a particular question for me. And what I did not mention on the last one, I know I gave some examples of, like, if you have a question about something, and I'm gonna read it, kind of what my channel will be formatted as. It doesn't have to be nursing school related, so it can be working as a nurse. It can just be anything to do with nursing, moving, specialties, college, school, whatever. I'll be more than happy to answer that. So I'm going to get off now. But again, let me know if you have any questions. And then also, if you're a new subscriber, please let me know in the comment box. And that's it for now. Okay? I'll talk to y'all later. Bye.